In this lesson, we will study ICD-10-CM Chapter 22, titled Codes for Special Purposes, covering the code range U00 through U85. This is a short chapter, but it contains high-importance rules, especially related to COVID-19 coding. This educational content is based on the ICD-10-CM official guidelines for coding and reporting. Coders must always consult the most current official coding manuals. Learning objectives. After completing this lesson, you will be able to identify the purpose of Chapter 22 codes, recognize the limited scope of U-codes, correctly apply COVID-19 related U-codes, differentiate active COVID-19 from post-COVID conditions, apply correct sequencing rules, and avoid common CPC examination traps. Overview of Chapter 22. Chapter 22 contains codes for special purposes only. Codes U00 through U49 are provisional assignments for new diseases, while codes U50 through U85 are reserved for future use. These codes are not routine diagnosis codes and are assigned only when specifically directed by official guidelines. Exam importance. Although Chapter 22 is very small, it carries high examination importance. COVID-19 coding rules are frequently tested, and most exam errors involve misuse or incorrect sequencing. Accurate memorization and guideline understanding are essential. Currently active U-codes. For CPC and CCS examinations, the most commonly tested U-codes are U07.0, U07.1, and U09.9. All three relate to COVID-19 or post-COVID conditions. Code U07.1, COVID-19. Code U07.1 is assigned for confirmed COVID-19 infection. Confirmation may be based on a positive laboratory test or provider documentation of confirmed COVID-19. This code is used only for active infection. U07.1 sequencing rule. When COVID-19 is the reason for the encounter, U07.1 is sequenced first. Additional codes are then assigned for manifestations such as pneumonia, acute respiratory failure, or sepsis. Exceptions apply only when another guideline specifically overrides this rule. U07.1 exam traps. Do not assign U07.1 for suspected COVID-19, possible COVID-19, or exposure only. In exposure-only cases, the appropriate Z exposure codes must be used instead. Code U07.0. U07.0 is reserved for emergency or special surveillance use. It is rarely used and must be assigned only when explicitly instructed by official guidance. It should not be assigned routinely. Post-COVID conditions. Some patients experience persistent or new symptoms after recovery from COVID-19. This clinical situation is known as post-COVID condition or long COVID. These cases require different coding rules. Code U09.9. U09.9, post-COVID-19 condition, unspecified, is assigned when the patient has a history of COVID-19, COVID-19 is no longer active, and symptoms persist or develop after recovery. U09.9 sequencing rule. When using U09.9, the specific condition is sequenced first, such as fatigue or shortness of breath. U09.9 is always assigned as an additional code and is never the principal diagnosis by itself. U07.1 vs U09.9. Explanation. Use U07.1 for active COVID-19 infection. Use U09.9 for post-COVID conditions. Use Z20.822 for exposure only. Use Z86.16 for history of COVID-19 without current symptoms. This distinction is frequently tested on exams. Vaping-related disorders. Vaping-related disorders do not have a unique U-code. They are coded using the appropriate respiratory diagnosis code, plus external cause or substance-related codes, as directed in Section ICD-10-E. What Chapter 22 does not include? Chapter 22 does not include exposure codes, screening codes, history codes, or vaccine encounter codes. These are reported using Chapter 21 Z codes. Common CPC exam errors. Common exam errors include using U07.1 for suspected COVID-19, using U09.9 for active infection, sequencing U09.9 as principal diagnosis, assigning U07.0 without instruction, and confusing exposure with infection. Exam recall summary. Remember these key points. Chapter 22 is very limited. U07.1 indicates active COVID-19. U09.9 indicates post-COVID condition. U09.9 is always secondary. Suspected COVID-19 does not qualify for U07.1. Always follow official sequencing rules. Lesson 24 Summary. In this lesson, we reviewed the purpose of Chapter 22, COVID-19 coding with U07.1, post-COVID condition coding with U09.9, sequencing rules, and high-risk CPC exam traps.